Bismillahirrahmanirrahim. Assalamu alaikum. Today we have a young 20 years old male patient who presented with the history of motorbike accident. Here we have sagittal T2 fat suppression sequence, and this one is coronal T2 fat suppression, and this is axial T2 fat suppression sequence. We can see joint effusion. This is normal retropatellar cartilage, and medial patellar reticula is normal as well, while there is mild sprain of lateral patellar reticula. We can see bone bruising along outer aspect of the lateral femoral condyle. Significant soft tissue edema is noted involving popliteus muscle and soft tissue and popliteal fossa. Here we have abnormal signals in and surroundings of medial collateral ligament. Iliotibial tract is unremarkable, while we can see this is the head of fibula with bone bruising over here, and we can see fibular portion of lateral collateral complex, which shows increased signals in its surrounding and in its upper portion. Popliteus muscle is inflamed, so there is sprain of both medial and lateral collateral ligaments. Here in sagittal fat suppression T2 weighted sequence, we can see there is mild osteochondral impaction injury of mid-anterior articular surface of lateral femoral condyle with the bone bruising in its adjacent portion. Bone bruising is appreciated in head of the fibula and posterior edge of the lateral tibial plateau, but we can see that lateral meniscus is unremarkable. This is quadriceps tendon and patellar tendon, both shows normal signals and morphology. Joint effusion is noted in suprapatellar bursa, and this is lumpy bumpy anterior cruciate ligament with extensive injury. We cannot see normal appearance as is noted in this posterior cruciate ligament. No signal abnormality appreciated in it. Its borders are smooth and sharp, but when we see ACL, it is presenting a pseudomass appearance suggesting total transection. So this is a case of acute total ACL transection, and we can see PCL is normal, and here we can see medial meniscus, anterior posterior horns, and its body appears unremarkable. Mild bone bruising is appreciated in medial femoral condyle. So in this case, we have seen total ACL transection, while PCL is normal. Both medial and lateral menisci are unremarkable. Quadriceps and patellar tendon appears normal. Sprain of collateral ligaments are noted, while bone bruising is appreciated, as we have seen, especially in lateral femoral condyle and posterior edge of the lateral tibial plateau. Joint effusion is also noted. We can compare ACL. This one is acute injury of the ACL with normal appearance of PCL. Soft tissue edema is noted in popliteal fossa, especially involving popliteus muscle. Thank you very much. Assalamu alaikum warahmatullah.